The Office of the Registrar of Medicines decided to withdraw pholcodine-containing products from the Namibian market. This is after the South African Health Product Regulatory Authority made a similar call a month later. The South African regulator cited increased risk of sudden, severe and life-threatening allergic reaction occurring in patients during surgery. According to the Namibia Medicine Regulatory Council, an alpha case control study was conducted by the European Pharmacovigilance Risk Assessment Committee to assess the relationship between pholcodine exposure and neuromuscular blocking agents related to anaphylaxis. The findings identified the use of pholcodine in 12 months before general anesthesia with neuromuscular blocking agents as a leading cause for developing anaphylactic reaction during surgery. The Office of the Registrar of Medicine has urged all marketing authorization holders, importers and healthcare professionals to withdraw and quarantine all pholcodine-containing products, suspend the prescribing and issuance or sale of pholcodine-containing products, and consider alternative options to treat patients' symptoms. Furthermore, patients are advised to stop taking pholcodine-containing products with immediate effect. The NBC News team caught up with the Executive Director in the Ministry of Health and Social Services, Ben Nangombe, to find out whether there is a call for alarm with regards to those who may have purchased the said cough suppressant prior to the findings coming to light.
It has been found that the medicines may contain some danger, particularly for individuals who have to undergo anesthetic and operations in the hospital. So if you have consumed the product as such, there is no danger to speak of. The danger comes when a patient would have to undergo surgery or operations. What we want to ensure is that we have safe and efficacious medicines. Anytime that we recognize that there is a medicine that may pose danger, in terms of the surveillance that we continue to do and the interactions that the Medicines Regulatory Authority is doing with other regulatory agencies around the world, we need to take action in order to protect the public. So those that are distributing the product should heed the advice, take it off the shelves, quarantine it until such time that the regulatory authority has pronounced itself.
Some local pharmacies have already removed all medicines containing pholcodine from their shelves. Nessa Njitaviwa, NBC News, Windhoek.